the CEO of PAVE Prevention, Proactive Anti-Violence Education. And you are watching us on our podcast of Disrupting the Dominoes. And when we say that, we're hoping to disrupt the dominoes that fall from violent events and just all those ripple effects that dealing with violence has in our world. So we have a really cool guest today, a good friend of mine. I'm really excited about interviewing him today. I've known him, wow, too long to admit, but Dr. Pietro Marghella, he goes by Pete. So Dr. Pete, welcome to our show.
Thanks, Arlene. Glad to be here. Glad to be able to join you and to help with the PAVE effort.
Yeah, well, Happy New Year.
Same to you. Best wishes for a healthier one, at least.
Yes. So let's just jump right into it. I have a couple questions that we kind of ask everyone on our podcast. So I want to share with you first. First of all, please tell me who you are. Tell me what you're doing. Share with our listeners and our watchers, our audience. Who is Dr. Pete?
So thanks. The short version is I am or at least regarded as a subject matter expert in disaster medicine and public health preparedness. I spent a long time as a career naval officer in a community called the Plans, Operations, and Medical Intelligence Community. And our job primarily was to design plans to ensure the adequacy of health service support for our warfighters. And out of that, in the post 9/11 era, many in our community, because of our work involved with writing these plans against large catastrophic level production events in terms of human casualties, we naturally gravitated towards the emergence of disaster and emergency management as a evidence-based science that has developed in the post 9/11 era. In the latter part of my career, while still in uniform, I served at the most senior positions of a medical planner in the Department of Defense, including the Chief of Medical Plans and Operations for the Joint Chiefs of Staff, the Senior Advisor for Medical Contingency Operations for the Office of the Secretary of Defense, and then the Medical Response Advisor to the President of the United States aboard the National Airborne Operations Center, the NAOC, which is sometimes better known as Night Watch, or more derisively in terms of threat, the Doomsday Plane. My job there would have been to advise the president on how we might be able to respond to any incident of national significance, but most of the time our planning had to do with response to nuclear events, which of course would have been the high-end scenario. In my post-military career, I've been the Director of Emergency Management for the state of New York. I've served as a professor of disaster medicine and public health preparedness at George Washington University School of Public Health, the George C. Marshall Center for European Security Studies, and the Massachusetts College of Pharmacy and Health Sciences teaching courses, mostly related to preparedness against large-scale events like pandemics. So when Arlene asked me to become involved with PAVE, I saw a natural affinity with some of the work that I've done in preparedness with some of the important work that PAVE is designed to do to change the workplace violence paradigm.
Dr. Pete, thank you so much for your service and everything that you've done for this country. I mean, it's amazing. I mean, I know I've seen your resume and I've heard your resume numerous times, but wow. I mean, what a life lived and what a commitment to service. So thank you for that.
Thank you. It truly was the great honor of my life to wear that uniform every day in service to my country. So thank you for acknowledging that and saying so. It's most appreciated.
So I'm going to ask you now, I mean, or I can talk about it, but I like kind of your stories on this. How did we meet?
Well, we go back, Arlene didn't want to enumerate the actual number of years, but it's more than 3 decades. Both of us, of course, were practitioners in the martial arts. Arlene has met with much, much greater success than I have. But when we were in our late teens and early 20s, we were competitors, thankfully never against each other, because I would have been a little scared fighting her, but in national tournaments through the national karate circuit. that still existed at that time, late 70s and early 80s. And then we happened to follow each other to Northern Virginia, where, of course, Ms. Limas opened up the one of the largest dojos in the United States. And both my daughter, Amberly, and I had the great fortune to train and practice with her and her top flight team of instructors there. So we have a lot of common ground we've walked over the years.
Yeah, it's crazy how, the world gets so small and, people who are supposed to be in your circle stay in your circle. They find a way to stay in your circle. So I'm grateful to have you definitely in my circle.
Exactly.
Okay, so let's get to some of the ideas that are around this podcast, and that is violence prevention. So the first question I'd like to ask you is, do you see a benefit of human safety skills being pulled into employee workplace training? What are your thoughts on?
Yeah, without a doubt. And I'm very interested in your comment or introduction into this program with its title as Disrupting the Dominoes. We studied, that is, those of us who were assessed into the Navy and into the professional world as healthcare administrators, this notion of organizational disruption through the presence of either disasters or other environmental issues that affect the ability to maintain organizational status quo or organizational homeostasis. And of course, most organizations' desire is to maintain a resilient organization. My friend Peter Hitt once defined that as the ability to function as normally as possible in the abnormal environment, which I think is a great definition. And we know through several sectors that we're looking at very carefully with PAVE and with Arlene right now, such as the healthcare sector, the hospitality sector, first responder and emergency management communities, the airline industry, and others, that this issue of workplace violence is not only pervasive and omnipresent, but it's costing organizations billions and billions of dollars a year in wasted money, in loss of manpower and capacity for organizational production. And it's an issue that we're just not addressing sufficiently enough in this country to have made a significant or really quantitative improvement at this point. So it just underscores the importance of an organization like PAVE with leadership like Ms. Limas coming in to try and address this and really make some change.
Yeah, I mean, I think one of the things that stuck out to me is one of our first conversations that we had, and I was trying to share with you what my vision for PAVE was and things we were going to address. And one of the phrases I used were microaggressions, and you kind of stopped me right in the middle of what I was talking about, and you said, Arlene, I would even say that these aren't even microaggressions; these are micro disasters, because for the person going through them, it's a disaster.
Of course it is.
And that has stuck with me. And I think sometimes certain personalities, and I'll use mine as being an athlete all my life, we see this through the resilience and the things that have happened to the gymnasts, the US gymnasts, is that we just kind of suck it up and we just move forward. But we could be so much more if we didn't have to suck it up, if we were actually given the ability and the skill set to address and heal from violent events. Who knows what potential we would reach, So yeah, that has really stuck in my mind, that term of a micro disaster. So yeah, I just wanted to share that. And I appreciate, your mindset on how, preparedness and the human safety skills all fall into place, because a lot of people don't, tend to fall to that vision right away. So I appreciate your view on that.
So if I might just add a thought, we have, there's two things to mention in the wake of your comments just now, Arlene. One is I definitely agree that microaggressions are easily comparable with micro disasters. When we try to explain what we do in this space, we normally put up a simple XY axis that we say represents what's known as the organizational continuum. And from its junction at the XY axis, you progress to the right and you can demonstrate three levels of organization: tactical, operational, and strategic. And people in disaster management and the emergency management arena are often prone to saying disasters are always local events, meaning they occur closest to that confluence of where the XY axis is along that organizational continuum. It becomes problematic as time goes forward and it moves to the right along that horizontal bar, if you will, because then it begins to, if it's not controlled, the disaster begins to cross from the tactical or micro-tactical in this case, of the simple persons or one-to-one relationships that are involved in dysfunctional relationship in some level of the organization. But if it's not controlled, it will progress upwards in an arc and start to affect the organization beyond its own boundaries into the operational and eventually the strategic level. And to make that easier to understand, when it hits the strategic level, we tend to notice it as a national issue, as in this is a national concern in the healthcare space because it's progressed so badly because we couldn't control it at the most local levels that it now on average costs healthcare leaders approximately $4 billion a year in lost revenue and lost profits because of having to manage these events, the issues with tort litigation that come along with it, the problems with manpower loss, lost time, lost production that I've already talked about. So this is a one-to-one comparison, and we often say that we have four phases of the disaster management life cycle. That's preparedness, mitigation, response, and recovery. And you can easily lay over those four levels and the initiatives that have to come with them for what PAVE prevention is trying to do. Because on the front end, if we can prevent and or prepare and or mitigate against these situations, it stops what we're paying for at the far end, which is response and recovery, which comparatively are always the most expensive, always the most difficult, and always the longest in terms of being able to change organization. So we're hoping that some of the strategies that PAVE is trying to bring to the table to help with these various sectors right now will help change things on the front end and lessen the impact on the far end.
Yeah, exactly. And I didn't see myself as much of a military thinker, but I fall in line so much with your military examples. So yeah, awesome. My next question to you, Dr. Pete, do you have a story you'd like to share where you experienced or witnessed workplace violence?
Yeah, I've been in the healthcare space for 35 years. And in the beginning, I was working directly in what we referred to as brick and mortar organizations or brick and mortar hospitals, actual HCOs, healthcare organizations, as the acronym or abbreviation is used in the healthcare field. And I very frequently, more frequently than I would have ever desired, saw firsthand the actions and impacts of workplace violence. Mostly in emergency rooms where we've always had problems with people who are either distressed because of trauma or injury, who were undergoing psychiatric distress or duress, maybe associated with that, or just purely psychiatric or psychological patients that are entering the healthcare space in the first place. We have the worried well, which includes parents and others who are demanding information from healthcare leaders, and sometimes passing the boundaries of security that we set up to try and keep the homeostasis of the ER at a normal pace, which is a stress place to begin with. So you add violence when these players come in who disrupt the ability for the providers to do their job, and it disrupts the whole organization. And unfortunately, I can take the stories that I've seen firsthand, and we can lay them over right now, what we're seeing writ large in the healthcare space because of the COVID pandemic. We have this great unknown of this terrible disease that's wreaking havoc and has killed, tens of millions of people, around the world and here in the US. We have rising concerns about these different variants, and the more unknowns that are injected into a situation, the more likely we are to see people who are what's the word I'm looking for?
Yeah, who've hit their limit. They've hit their
They reach their peak, and
Yep.
they lose their ability to control their emotions, and that turns into physical threat and physical violence, and that's what we need to prevent. And it's an unhappy truism that as the arc of in my world, the disaster goes up, we see a descending lack of control in these spaces where we likewise see, violence increase significantly. And then of course you add to that whole situation the problem, at least here in the United States, with the opioid crisis, and this is a problem on steroids, unfortunately.
Yeah. Yeah. Um, I found myself the other day, and I think I'm a pretty even-keeled person. And I was taking my uncle to a doctor's appointment that had been canceled, even though I had I had a portal message that said the appointment was on, an email confirming the email was on, an email asking me to fill out some questionnaire saying that it was on. When we got there, they said, oh, it had been canceled. But I found myself when I got there, now that I've put my uncle in a situation where he could be exposed to the new variant, very stressed and very upset that I had made this trip and it had been canceled. And I quickly caught myself, but I could see how people would be in that situation, elevated emotions, and just go after the person who's sitting behind the desk who has no control over the fact that the doctor didn't come in today. So yeah, I mean, in those settings, I'm sure it can be incredibly tense. And you and I have had the discussion as far as you have seen and that nurses, emergency room nurses are not given the skill set of de-escalation.
No, I'm going to offer a lot of similes between my space, that is public health preparedness, and what is happening in the workplace environment in terms of concerns, because we don't train. We have complained, if you will, that we don't offer doctors, nurses, and the wide spectrum of allied health scientists any sort of training in their academic pipelines for disaster preparedness and emergency preparedness. And then when it comes time for them to be key response professionals in helping us adjudicate an incident that has occurred, we put them in tenuous positions because they don't have the skill sets and they can't be blamed. Likewise, in the healthcare space, we don't, in the physician pipeline or the nursing pipeline or the laboratory professionals pipeline, or even the healthcare administrator who's often the person on the spot to come and de-escalate problems that are occurring due to conflict between a provider and a patient, give them any skills in terms of risk management reduction, trying to talk people down, if I can put it into common terms.
Right.
And then especially at the end of the day, we of course don't teach them any self-defense skills whatsoever.
Right.
And we know, of course, as martial artists, that, and we haven't mentioned is that, like Miss Limas, I've been a practicing martial artist for almost 45 years now.
Yeah.
You don't learn how to defend yourself by reading a book or getting a weekend lesson in self-defense. So in some cases, it's more dangerous to send a nurse or a flight attendant or anybody else, like a hospitality manager, through a weekend of a self-defense course and hope that they're going to have the skills to physically de-escalate a situation when it starts to occur in the environments that they work in. So the approach is not this sudden hands-on. It's got to come from some intellectualized approach that we can develop to change behaviors in these workplaces and give people skills that don't involve putting themselves at further risk through physical interaction with antagonists.
Yeah, exactly. I mean, that's why I think what PAVE offers is just so unique and such a fresh approach, being trauma informed, having a lot of built-in scenarios that get your adrenaline up, and you're going through these scenarios and you're reacting into these scenarios under adrenaline pressure. I think, it really gives the chance to impart in real time, impart these skills to in the workforce, especially, where I see it as you see it in the healthcare sector. So, okay, my next question, Dr. Pete. Do you see PAVE programming contributing to our nation's emergency workers. So like FEMA, you had shared some stories with me in the past about the tremendous pressure that FEMA workers are put under.
Yeah, that of course, this is the space I've had the most firsthand experience with. And I've been in disaster locations like Katrina, like both the Pentagon and New York on 9/11, many places around the world during my military career, where I see the immediate aftermath of disasters, and in each of those cases, you've completely lost control of normal homeostasis and infrastructure support, and people completely lose the resources that in many cases they simply take for granted on a daily basis. Malcolm
Yep.
Gladwell wrote a great book called The Tipping Point, and it's a really good analogy, because when these disasters occur, we have people that are reliant in relatively small geographic areas on what is essentially very static critical infrastructure capabilities to support them: water, healthcare, foodstuffs, et cetera. And they all go away quite quickly, because unfortunately, we in this country at least don't do enough pre-event deliberate planning to figure out how we're going to stop those cascades from happening. So when
Right.
it happens, people, we know that there are very significant behavioral and social science concerns with disaster affected populations that we yearn to put our arms around and control. Because one of the things that we become most worried about is that the people who are sent in as the first responders, whether they're fire, police, or emergency medical personnel, become almost instantly at further risk because of the demands of the affected population and their needs not being met. So in those cases, we see violence absolutely spike as a first order of magnitude cascade that occurs after disasters happen. And what we don't want, of course, is for those situations to instantly turn into scenarios where part of the first responder community, that being law enforcement and police, have to respond in turn with violence to control these populations. So if we give our first responder and public safety personnel some of these skills that we're trying to impart with PAVE prevention, again, it's our hope that it lessens the impact of these disasters. It reduces the vibrational issues that are endemic to disaster affected populations and locales. And in the end, we hope that we'll see safer and better outcomes. And of course, expedited response, which is exactly what we want to have happen,
Right.
to reduce the response and recovery time.
Yeah, exactly. Exactly. The next question I have for you, Dr. Pete, is I think you've touched upon this already through our conversation, but I'm gonna ask you to pinpoint it for me. How, where do you see PAVE contributing in preventing violence for the healthcare sector?
I think, Arlene, it's a phased answer, because I think organizationally you have to get C-suite leadership involved first, and you have to get them, to understand that there's a problem, which I don't think is the reach. They're the ones that are in control of the financial purse strings of organizations, and whether it's in hospitality or healthcare, emergency management, or the airline industry, we're seeing some of these most impactful concerns with workplace violence. Those CEOs know already. What they don't know is that there is an organization like PAVE Prevention that's
Right.
out there now that's trying to put real, serious, and important thought to theories and practices that can be put in place that can reduce their impacts. Right now, it's like an organization that doesn't prepare for a disaster. When the disasters occur, they're blind, and they're
Right.
mucking around in the darkness, looking to grasp hold of something of permanence to settle the environmental jolt that has just occurred on them. So in sort of a first tier approach, I think in the beginning it's going to be a matter of adequate marketing, to let organizations in these spaces that are being so badly impacted by workplace violence, that there is an organization out there that's thinking about this, that is dedicated
Yep.
to reducing this problem in these sectors and in our nation. And then once that occurs, then of course, I think the initiative is going to go viral because, as I said, it's not hard to recognize what this problem is doing to industries in many sectors in this country and what the cost is in terms of being associated with it.
Right, exactly. I mean, it's a huge cost. We know that. I mean, when we started looking at some of the statistics, they were just mind blowing. I think that it's very clear when we talk to people that they understand that violence is impacting their business, right? And their employees should have the skill set to stop it. I think that they understand that their employees should also have the not only prevent it, but if it occurs in real time, the skill set to defend themselves or prepare themselves or de-escalate the situation. But for me, what I feel is the most powerful, but it's the hardest to share that information with people, is how we heal, how people heal once they're imparted this skill set, how that helps them heal. So I think I've shared to you that I lost my home to a fire. And because of being empowered by martial arts, and a lot of these principles flow into PAVE programming, martial arts principles, that's what really got me through it. Is I was just able to take control of certain things. Since I didn't have control in things like my house burning down, I was able to be empowered and take control of something in my life through the martial arts.
Yeah.
And I don't, maybe you can speak to it, what an important component, being given a skill set to help you heal from something happening.
I'll go back first off to what I was talking about a minute ago about that operational continuum, and I'm thinking now that as I elucidated that thought, I was really only presenting it occurring in one direction, that is from left to right along that continuum, where it might go up and cross into other levels of organization that are at least higher than the original one where the event occurred. But I'd be remiss in pointing out that in terms of workplace violence, it works the other way too, meaning that the people who are most closely involved take home those issues. They bring them to first their families and their loved ones, that sometimes end up causing emotional and physical strain within the micro-tactical environment of the individual home. And we can't have this discussion either without understanding that violence of any sort, whether it's in the workplace or a major disaster or fire, it creates conditions which are right for creating depression, anxiety, in some cases suicidal, and less than often, but still in some cases homicidal ideation towards others because of people's inability to deal with the problems they've encountered. It's an interesting statistic in terms of a retrospective, in that 10 years after 9/11, at a meeting that was hosted by my organization, the Office of Emergency Management for New York State, we found out that there were some 65,000 people below 42nd Street in Manhattan who were in active treatment for PTSD, post-traumatic stress disorder, anxiety, crippling in some cases, crippling anxiety disorders. And this is where I talk about, in those 4 phases of the disaster management life cycle, are going to be the issues that last the longest, are most expensive in terms of treatment. And unless something intervenes, unless we provide an intervention for changing that flow, it A, gets worse over time, and B, becomes more difficult to pull back. So if we can in place strategies for this issue of workplace violence that reduces the chance of people affected by these events from having these long-term sequelae of these impacts, then it's not only going to give us a healthier population writ large, it's going to save us money, and it's going to put the organization back to status quo ante as it was before, in hopefully a better place.
Right, exactly. Yeah, I mean, you see an intervention, I'll just push in there, disrupting the dominoes, right? Yeah, so that's what we're looking to do. That's what we're looking to do. Dr. Pete, this has been so much fun. I'm going to give you our last question. It's a little corny and hokey, but I'm going to ask it anyway. If you could convince one person, if you could have the audience of one person that would help push our initiative forward, who would that be and why?
You know, I can't help it. You know, with a question like that at a time like this, we've had a meta leader. A meta leader. My New York accent comes into play sometimes, but we've had a meta leader step into our space nationally in trying to help reduce the impact of this pandemic and this ongoing long-term disaster that we're all seeing and feeling. It's touched everybody's life, and the single voice of reason that I think the majority of us, have come to believe in is Dr. Fauci. And I think Dr. Fauci would argue the same as I would in this case, because of these one-to-one similarities between, these micro-tactical events, microaggressions, as we're calling them, in the workplace, and then these major large-scale disasters that are impacting the country and almost every organization. And I think, he speaks a lot of the planners speak when I hear him talk. About strategies to prevent, to mitigate, to help us in the long term. You can even hear him, if you listen closely, talking, about, one day this is going to be over, and what are we going to do to recover, to respond and recover from this disruption that has occurred in our national environment. So I think, one, you would have a big fan in the like of Dr. Fauci, but I think he would be another great voice to help send the message home, because it's not a far reach to understand, the similarities between what we try and do in disaster medicine and public health preparedness and what we're trying to do with the PAVE prevention initiative. It's just really coming, both are coming bottoms up, but one tends to try and address, larger issues that, come with incidents of national significance. But if, it's a final note, Arlene, if we continue to let this go, especially in this period of severe disruption, this is going to become a worsening national issue. We can see the economic impact already. The changes every day when we watch the news about, just turn on the TV right now and listen to what's happening in the airline industry, and the anger and the frustration by both the people who are buying their services and the people who are providing the services in the first place. And I think, any listener would understand the imperative behind what you're trying to do.
Well, I did not see that one coming. I would not have seen that one coming, but I see with your explanation why that would be a perfect choice to gain that audience. That's for sure, Dr. Fauci. Wow, Dr. Pete, thank you so much for taking your time out of your day to do this. Thank you for all the support you've given PAVE prevention. Is there anything else you'd like to say before we close it out?
No, I think, well, I do, yes. First off, thank you for allowing me to be involved with this. I clearly have been into this hard, because I think it's an important initiative that I don't think we've given enough of our time and intellectual efforts to changing. But I couldn't think of a finer leader to be at the helm of an initiative like this. Arlene Limas is a fighter, and we need somebody on point to take on this monster of a challenge and defeat it. And I think with her leadership, we're moving certainly in the right direction.
Oh, thanks, Dr. Pete. All right, everyone, this has been awesome. I'm having so much fun doing these podcast interviews. I appreciate your time today. I hope you enjoyed it, and you've been watching Disrupting the Dominoes. Thank you very much.